Loud. Okay, we're rolling. Okay, Regina.
Okay. All right. Hello. Oh, sorry. Hello, everyone. My name is Regina Floria, and I just wanted to give you a little bit of background before we get started. And if you are, if the people in attendance are okay with, introducing themselves, just to see like kind of what brought you to this training, and if there's anything like you were really hoping to get out of it, and then if there's any questions that I can answer, or if I can, I'll make sure that I do the research and can get back to you if there's anything that leaving this training today that we're still not sure about. But I have my master's in applied behavior, and I've been in the helping social work field for about 15 plus years. I work with like across the lifespan with children and adolescents all the way up to seniors, and in different settings of behavioral health, medical, and substance abuse. So I've always had the desire to like help advocate for some population that is either underserved or is, it's a confusing navigating the different systems in healthcare. And so that's always been my kind of passion to help parents, families getting through these like the red tape of everything. So I am currently working for a company called Mercy Life. We're also known as Trinity Healthcare. And the LIFE program just recently came to Chester, Montgomery County about 2 years ago. So right now we're calling our program the Safer at Home model because of COVID. And I'll explain kind of how things have we've modified things to be able to still meet the needs of our community during this time. But I want to start kind of back at the beginning of how you even access, senior services. But before I do that, I didn't know if anyone wanted to, have any questions or anything that you were really hoping to get out of today's training that I can kind of focus in on.
Can feel free to unmute yourselves or put something in the chat.
Hi, I'm just here to learn about your services. I don't really have questions because I need to know what you're offering.
Okay, all right, great. Thank you for joining today. And please feel free to stop me at any time if I'm not being clear about something. So I will, first, I want to kind of go over scenarios, like typically when people are entering the services, has been like an issue, either something typically is prompted, whether they've noticed that their family member they're getting more forgetful, they're living on their own, the concerns are coming up as far as their safety, or there's been a fall or an incident. So just wanted to this kind of a couple things that sometimes I hear in the beginning of someone seeking treatment. So for instance, my mother had a fall going up her front steps at her house. She's just now being discharged from the hospital. She's going into short-term rehab, but she's going to need help moving forward. I have no idea where to start. And then, Dad just turned 60 and he's beginning signs of dementia, forgetting, he heated food in the microwave or confused while getting dressed. Just the simple tasks of, where my shirt and pants are and how does he, get dressed. It's so difficult to watch my father struggle, and he needs services as soon as possible. And then the third is I need an aide to come wash my floors. They are a mess and I have to clean with one hand and a sling and bending over while I'm in my wheelchair. So I mean, all different scenarios of why people, begin to think about seeking services. And the first question is always like, where to begin? So I am going to kind of go over where the entryway into the different counties and how you seek services. So I just have this here, nothing is more beautiful than a smile that has struggled through years and tears. Just feeling that compassion and wanting to help make this process as smooth and easy as possible for people and seniors and their families. So I'm going to start with Montgomery County and Chester County have a little bit different processes. So I was going to kind of go over each process, and I mean it's fairly simple as far as the contact, but if there's any questions, please feel free to stop me. So when you're seeking services.
Briefly, I'm so sorry. Are you going to be sending out a copy of this? Of what
Yes, absolutely. And then I was also thinking if you wanted to leave your, if your email, if you feel comfortable leaving it in the chat, then I can, send you, I have some resources I wanted to send out as well as the copy of this.
I'm not comfortable doing that. Mark, since you have our emails, can you just send it
Yeah,
out?
that would be fine. I'll send it to Mark.
Yeah,
Mark,
Regina can just send it to me
Sure.
and then I'll send it to everyone. Sure.
Absolutely.
I'm sorry,
Great.
you're saying I have to send it to you, Mark, my email request?
If you're registered for this, I have your email.
Oh, then you'll just send it out. Thank you.
Yep. Mm-hmm.
So for Montgomery County, when you're seeking services, the kind of entryway or gateway into services is calling community connections. Their community connections are there's a team of specialists who have the knowledge to assess and kind of figure out which direction by what you're reporting, what direction they need to guide you in. So their team is called Navigates, and they help triage or send you in the right direction as far as the service and program options. So they'll ask a set of questions, and by the answers and discussion, then they'll know kind of which direction they think you'd be best or most appropriate for you or your family member. So so for Chester County Aging Services, so what is available to me or my family member? So the first, as far as entering the service arena in Chester County, is the it's the Aging and Adult Services. So they're the main navigators into service options for seniors. So it's called an intake and referral specialist that you would reach initially. It's Chester County Adult and Aging Services. And the INR specialist, their information and referral specialist, completes a referral, and there's a couple things that they'll need to know initially when you're calling. So just to kind of have an idea of what they'll be asking, your demographic information, your primary health concerns, and then other contacts as well as activities of daily living. So this is really important because a lot of times people think that maybe if they have to have like a certain diagnosis or a chronic condition to get services, and that could be the case, but what they're really looking for is how you navigate through your day, how you manage your activities of daily living, and they include bathing, getting dressed, taking your medication. Can you do that independently, or do you depend on others, family members, to help you through the bathing or managing your medication, or any activity of daily living, cooking, getting to the store, getting to doctor's appointments. So they're going to look at the specialist will complete the referral, and then once the assessor who is going to be calling to ask these questions, they're going to be looking at the main factors as far as how are you functioning throughout your day, and if you're depending on whether they think you're dependent or partially dependent, that's going to really depend on kind of what services are recommended. But so a couple things they really kind of hone in on, and so bathing and incontinence, medication, and then cognitive. So, are you oriented time and place? Meaning, kind of, are you in the present? Are you able to tell like the date and information so that they can test your memory to see if you are able to kind of function at the rate that you were originally, or has there been some type of change? And they usually look back with like even just in the past couple of days from the time of the assessment. So once the intake and referral specialist, they'll take the initial referral information, and then they'll typically email you or mail out information about services and options of programs in the community. And then once they do that, then the assessor evaluates the family member or the senior, and makes recommendations for treatment. So just to kind of go over the referral process, who can make a referral for services or to be assessed? An agency representative, family member, or the actual individual requesting services. So it can be if there's already someone involved, an agency involved in the care, in your care or your family member's care, they can make that referral, or they can make it with you, or a family member or yourself. And then who would they speak with to make a referral? It's the INR specialist. And what information should you be prepared to provide, which we kind of went over already, but just, kind of a checklist of some things to kind of keep in mind or prepare before you call. And that's, again, demographic, health concerns, and then your bathing, dressing, toileting, and other activities of daily living. So is there any questions so far?
Yeah, I'm sorry, I kind of lost the big picture of how do we get the original phone number for whatever this department is?
Okay, so yes, so I'm going to provide both of those numbers, just kind of going over. So it's the Community Connections for Montgomery County, and then it's Aging and Adult Services for Chester, and I'll provide both of those contact numbers. And basically, when you call them, this is just kind of what to expect that they're going to be asking, and going over, what questions to kind of keep in mind when calling.
Thank you.
Mm-hmm. Okay, so this is, so you can complete a referral online. You can print a referral and mail it in, and then, or you can actually ask for assistance with submitting forms if you need to be by calling this number. So again, I'll be forwarding this information to Mark to be able to disperse, so that you have this copy. So I just wanted to kind of go over briefly, this is not a great copy, but so there are several different providers in different service areas. So the LIFE program covers the majority of Montgomery County, and then some zip codes of Chester County as well. So Phoenixville and then Montclair and Oaks are kind of on the borderline. They're in this area particularly, and then all the way from like East Norton and Jeffersonville, and then all the way up to like past Gilbertsville, and then down until right before like mainline Bryn Mawr area. So I actually am gonna send along with this a better copy, but by zip codes it tells you, with the area that you're in, like where, who's your service provider. So the LIFE program in Norristown is going to be all of Phoenixville and the nearby areas. But if there was someone, say, that wanted to access the program that that lives in like Lansdale or somewhere else that has a different LIFE program contact, I want to be able to have you have access to that as well. So going back to the Montgomery County and the Community Connections, like we were saying, they're the contact number to access senior services. They will direct, they'll ask a set of questions just like Chester County, and then they'll direct you in. And it's not just even for senior services, they're a good referral source for any service in the county that you're looking for. Whether it's housing or food banks or any other type of financial assistance. So it's really just a good contact to help you navigate any of the supports that you may need. And they're called navigates because it's advocate and like kind of navigating. They help navigate. So now, so possible outcomes. So once the Montgomery County or Chester County Aging Services comes out, or right now they're doing telephonic assessments. So they're scheduling a time to reach out to the individual or the family member and the individual to complete the assessment over the phone. And that's continuing until further notice. I'm not sure, if that's going to be changing anytime soon or not. But they're asking the same set of questions over the phone and making a determination as to whether they think, what services are appropriate. So a couple options or outcomes of programs that could be recommended are listed here. And so I have a lot of information in here. So if, I'm not going to go over every single detail, but if you have questions or if you need further information, it is listed in this document. So the first one is the Aging Waiver Program. And so there's two community-based waiver programs that are available. And the the individuals have to be 60 or older, and in order to access the waiver programs, you have to be eligible. It's for nursing home placement. Now, this is to be provided, though, instead of, the alternative is the community-based services. So although they're saying that your activities of daily living or your functioning could be eligible for a nursing home placement, this is not to place you in a nursing home. This is to place you in a program in the community to prevent you from nursing home placement, to be able to keep you as healthy as possible in your home, in your community, and providing all the necessary supports that you would need to be able to do that. So there are some eligibility requirements. Now, the Mercy Life Safer at Home program is a part of the waiver program. So that's one of the options that I'm going to go into in detail in a few minutes. And then the other is the home waiver. Now, and that process is you still meet with the assessor. They still have to make a recommendation they're going to say you're nursing facility eligible, but basically what that means is that you'll be eligible for the waiver program, which are two programs that are at no cost to you, and there's basically it's going to be a process of going through the same process that you would go to enter into a nursing home placement would be to get into these programs, but it's not actually, I think people get very kind of not defensive, but guarded when they hear nursing home placement. And, I just kind of want to go over that. This is really to prevent that and to provide the services you need it. And in order to do that, in order to get, the services at no cost, we have certain things that we have to provide to the county assistance office in order to show, that eligibility is met. Now, there's two things that you can be eligible for the program. It's medical eligibility and financial. So there are some guidelines as far as monthly income, asset limits, and showing within the past 5 years as far as the bank statement showing that you are still under certain monthly income and that your assets are under $8,000, which is the limit. And so sometimes there's a lot of information requested from the senior individual, but for the life program, we really try and help navigate through that and help access that information as easily as possible so that it's not all left on the individual, because it's a lot of work to gather this information. It's like you're submitting an application for Medicaid, medical assistance. So this is a process that's done before you enroll in the program, but myself and my coworker, we work together to help navigate it and help to get the process done as quickly and seamless as possible, so that you can get the help that you need as quickly as possible. The program does enroll in the first of every month, just to convey that too. So this is just going over, as I said, some of the things that are requested in order to assess eligibility, and the medical eligibility comes from the aging and adult assessor. There are, the options program is a program that's less intensive than the waiver program. It can provide aid hours in the home, but very brief hours, up to around 8 hours a week maximum, and that's assessed by the provider that's going to be giving the services, providing the services. So the program provides home and community-based services to enable consumers to remain in their home. These services are provided on a sliding fee scale. So options program is typically something that's recommended or suggested if the waiver program is not appropriate, either because of financial or medical eligibility. So this is another option. And then the Family Caregiver Support Program is also an option in order to help manage and purchase and the caregiver's needs. And then the goal of the program is to reduce caregiver stress and reinforce the care being provided to the older persons at home. So they're really thinking too about the stress and on the actual caregiver whether it's most of the time it's, one family member, or it's a, daughter or someone in the family who's kind of been designated. And it tends to, when a lot of times when we speak to the caregivers, it's a lot of stress, and they want to do the best that they can for their family member, but it's getting a lot, it's getting to be a lot to handle. So this is another option to give some relief. So the programs, the nursing home transition program is another program that if you are in a temporary nursing home placement, there are a nurse case manager and another provider, social worker, that helps kind of look at what the needs are, so that when you're going back into the community, back into your home, that you have all of your needs met. And a lot of times they look at the waiver program to see, if that's most appropriate. And that would be either the home waiver, which would be an aid in the home for a certain amount of hours per week, or that would be the LIFE program, the Sacred Home model that I was referencing earlier. So the Mercy Life program is one of the options as well. So here's just the contact information for the Montgomery County for assessments. I put that here, and like I said, you'll have that to reference. And then, so I'm going to stop before I get into the specifics of our LIFE program, and to see if there's any other questions.
Yeah, could you put that last slide? That went too quickly. Okay.
Yeah, sure. I'm sorry. This one?
Yeah.
Mm-hmm.
Thank you.
Mm-hmm.
All right.
You good? Are you okay? Okay. Okay. So Mercy Life, so the origination was from the Pride of Mercy nuns. Our program is now nationwide, and our first site in Central Montgomery County opened about 2 years ago, and that's I am a community liaison for the program that's located in Norristown on DeKalb Street. It's where this old Sacred Heart Hospital used to be. A lot of times people are familiar, if they're from this community, with the Sacred Heart Hospital. So we're in this one of the side building on the whole side of where the old hospital used to be. It's a brand new remodeled. It's a gorgeous, bright, beautiful facility where we provide the wellness center, and the wellness center is a combination. We call it like wraparound services, or a combination of medical care and socialization and physical therapy, and providing all the types of specialist care that someone would need to stay as healthy as possible. And then also we have a cafeteria that we provide breakfast and lunch. Now, prefacing it by saying that right now it is a little different because of COVID. We have our medical clinic is absolutely still open, and our physical and occupational therapy is still being provided. We're just not doing the socialization where participants come and gather at our facility. And we used to have like entertainment come in, and all types of fun activities, and an outside porch area that they would gather in. And we had like a separate room for computers and a library. But right now, hopefully soon we'll start slowly reopening. But right now, those type of services are not provided in person. But we actually have some really a great staff who's actually kind of put together a phone, or if somebody can access by Zoom, they're doing actually games over the phone or Zoom. They're actually having like spiritual like support groups and different activities. They're still trying to keep those connections alive between the participants. What we found is that the loneliness and the isolation from COVID has really been detrimental to the mental health of everyone. But seniors who are already isolated at times, they're really getting hit hard with feeling the loneliness. So we're really trying to find creative ways to really like keep them connected and keeping them feeling like they have their purpose.
I just have a question.
Mm-hmm.
I think I heard one little bleep where you mentioned that you have to have less than $8,000 in assets to be eligible.
Yes.
Oh, okay.
Yes. So what that would mean is, and we can definitely, if you wanted to talk, more in depth, we could definitely have a phone conversation. But essentially, a cash value of 8,000 or less it's a Medicaid guideline, and that's what we're going by. So it's not necessarily the life program, but it's the Medicaid guidelines that are saying you have to have make under a certain amount per month, and then have a certain amount of assets.
So if you own a home, then you wouldn't be eligible for this.
Actually, no, the home is excluded with the assets.
Oh.
Yeah, so that the home, you can own a home, you can own a car. So it's aside from those things, it's more or less if you have cash in checking, savings, a 401k retirement plan, or like a life insurance policy that has like a higher cash value, those type of things.
No, thank you.
Mm-hmm. Okay, so we have our own, Mercy Life program. We provide, we cover all of the healthcare claims, all of your medical costs, prescriptions, inpatient hospitalizations, short-term rehab if needed, long-term, care if needed. So everything is covered at no cost, being that you're eligible medically and financially, and you can be a part of our program forever. We really provide care ongoing, and there's no kind of exhaustion as far as amount of visits. Physical therapy visits are just, they can continue. They're not going to end after a certain period of time. Like Medicare visits can be kind of managed, strictly like that. So we're really looking at long-term care here, and it's what you need to be successful and healthy. We could look at the nutrition as well. And so we really are looking at the whole system and the whole person as far as keeping you as healthy as possible. So that could be the physical therapy. It could be a few hours of an aide in the home to help you get a shower. It's really like transportation to medical appointments, helping you schedule medical appointments. It's really like whatever is going to help take some of the stress off of you and the caregiver, and help you maintain that care that you need. So like I said, we have our own provider directory. We provide dental, vision, and podiatry at no cost, and we have consistent drivers. There are employees, so you're seeing the same transportation drivers when they pick you up for appointments or pick you up to bring you to our center and home. And so there's that, I feel like that's consistent safety, as well as that you're not going to be waiting for hours on end for transportation. So just to kind of give a brief history, we have 122 life programs. The reason why it says PACE here is that PACE is Programs of All-Inclusive Care for the Elderly. That's what our program is referred to outside of Montgomery County and Chester County. And the reason being is that there's already a PACE program for medication assistance in our counties. And so we refer to our program as the LIFE program, Living Independently for Elders. So it's a national model. We have 122 programs in 31 states, and we have 240 centers. And then we have 42,000 plus participants across nationwide. We have under 100 participants in our Norristown Center. So we have a clinical team or a team of medical professionals that work together on a daily basis to manage the care of our participants. So there's the social worker and the physician and nurse and the therapist. They're all talking on a daily basis as in their morning meetings as to what each participant is needing, if there's been changes. They manage the medication, so no one's getting the wrong prescription or overly prescribed medications that are overlapping or have adverse effects, because they're managing the care of each individual. So I think that is like one of the most valuable, I feel like, facts about the program, as well as the fact that you're seen once a month at minimum, and we really kind of take a look at what's individually needed, not just kind of like like everybody gets the same type of care. It's really individual as to whether what specialists need to be considered, or how many hours of aid services or physical therapy. And the social worker is someone who's a regular, constant kind of managing that as well. So I just think it's wonderful to get that type of individualized care that that you really don't, you really can't access typically. So just to kind of go over the eligibility requirements, you have to be 55 years of age or older for the LIFE program. You have to live in a service area, meaning your zip code has to be included in the center closest to you. And you have to be certified as needing the nursing home care, like we talked about earlier, and financially eligible. There is an option to accept private pay that can be discussed. There's, typically it's the people who are participants are financially eligible for our program. And the max income in order to be eligible is $2,349 per month. And then, like we talked about, the asset limit of $8,000. So the other, and then the other criteria is that you're able to live safely in the community. If you're either alone or with someone in your home, but you're able to live safely without a daily risk of falling, or the conditions of your home are suitable for your needs. So that's really important to kind of take a look at. Any questions? I'm like throwing a lot of information out here. So our philosophy is just to stay in familiar surroundings in the community, to maintain autonomy, and to maintain the maximum level of like your physical, social, and cognitive function. We're really focused on all areas, of the participant's life. So this is just kind of going over, we still really think of the caregivers too. So our day program typically would be open 5 days a week, Monday through Friday. And, we provide breakfast and lunch, like I was saying, in a lot of different activities in our medical center. So it's a full day. If, for example, typically if someone had like a doctor's appointment at our center, they could come in for breakfast, have their physical therapy, maybe participate in one of our activities, whether it's an art project or if it's someone coming out from like for entertainment, and then go to their appointment, and then our transportation would bring them home. So a lot of times it worked out really well as far as the schedule. And again, they're still getting physical therapy. They're still getting their appointments with the physician. They're still getting all of their care. The only exception is that the socialization with the activities and our cafeteria are not open, but we're modifying that by providing the services in the home, over the phone, or virtual, and we're still providing the transportation to appointments. So support and respite for caregivers, providing the peace of mind that they're not the ones scheduling all the appointments, making sure they pick up their mom's prescription at the pharmacy, all of those things that really can be a lot to handle themselves. We send medication home every 2 weeks. We manage that piece for them. And we also can have different, I want to show you an example of how the medication can be kind of organized in these packs that make it really, really helpful to seeing like what the name of the medication is, what it's for. The name on each tab is on the back here, so it kind of explains. So we do different organizing the medications in ways that make it safer and easier to take on a daily basis. We also do we can do a daily bag medicine where it's like morning dose and it's already bagged up, and you just kind of swipe it off of from the box, and it just has everything that you're supposed to take and what it is, what it's for, etc. And I think that's another great option too for some people who kind of typically have trouble managing all of their pills.
Regina, there is a comment in the chat. They'd like you to clarify, if assets are more than $8,000, then one is not eligible for these services.
So the assets are, it depends on what's going on. There's options. There's options where it's kind of, there's a lot of different options I'd love to talk to you more about, but essentially you can either, if it's like right over 8,000, we can talk about ways to, would it make sense to like maybe figure out if you needed something to pay off a bill or et cetera to get that amount down, or it depends what it is that, what type of assets you have. So, so that it all really depends, but essentially 8,000 is where the county assistance office will look at if they're going to approve or deny services. But like I said, it's not cut and dry. So I would love, if you wanted to talk more about it, I could kind of explain it in a little thoroughly. That kind of answer. So there's alternative ways to kind of manage that. Now, the one hard line is the income. There's nothing, the income is really what it is, and it can't go above that, which is the 2,349. Does that help a little bit? And I can't see. I'm trying to see if I can see the chat too here. So again, if you wanted to talk at a later time, or ask Mark to to ask me questions, however you feel most comfortable kind of communicating, I'd be more than happy to do that. So just kind of a visual look at what I was talking about as far as all the players at our program that talk on a regular basis, and how they're part of the interdisciplinary team. And they're the ones that meet with the individual before enrolling in the program to get together with the individual to kind of create a plan of care, something that works for them and meets their needs and keeps them healthy. So registered nurse, recreation therapist, spiritual care, if appropriate, dietitian, occupational therapist, the nurse manager, our home care coordinator, personal care assistant, the driver, and our primary care provider, plus our social worker. So all of these professionals together are working to make sure, and we have an on-call or after-hours line in case there is someone who needs to reach our staff. And we really take a look too at the home and if it can be arranged in a better fashion to get around, or if there's any type of medical equipment or supplies that would help assist the individual, because we also kind of assess and provide those as well. And then this is just kind of, these are a list of the services that we provide. Sometimes it's helpful to see, we provide basically any medical service we will cover, and help find a specialist if you don't already have one, and coordinate that care for you. So medical services, and then home care, rehab, social services, and then dietary needs as well. So it really is kind of all-inclusive and like a holistic version, a holistic way to manage the senior's care. So just another kind of care coordination, like I've touched on several times already, but just kind of patient-centered. It's an interdisciplinary team. I think that's one of the most important and key things about the program that I find are the most valuable, as far as there's so many times that I've seen seniors prescribe different medications that should not be taken together, that are causing adverse effects, and I just feel like that's such an issue, and I find that it's prevented when all the players are communicating on a daily basis, or communicating on a regular basis. So some of the crafts that have been done, I actually go into some of the different area agencies and senior buildings, and just do different crafts, and these are some of the ones that I've done with them. But they really, they're just really fun, and really fun activities that we have, either myself going in to different agencies and at our center, which we'll hope to resume soon. So just really kind of coming to the end of what we're trying to achieve here. We don't want to see our seniors going in and out of the ER. We don't want to see them like in hospitalization. Sometimes we find that seniors are going to the hospital once a month into the ER because they don't know what else to do when they're having symptoms. So we're really looking to kind of prevent that, prevent the, the risk of the drug interactions with different providers prescribing, lower the chance of them being placed in long-term nursing home. So we're really trying to keep them in homes where they want to be. And that's the overall goal of our program. And it's amazing. I mean, I have seen some major transformations as far as some of the seniors that I've worked with in the past beginning the program, and just the complete just 360. I'm thinking of one individual in particular. When I went to his home the first time, he was in really bad shape. This gentleman had almost had his foot amputated because of an infection. He was depressed and very kind of disheveled. He had he was losing hope, it seemed. So, once we were able to get him enrolled in the program, and our specialist, our wound care specialist was seeing him, at our center daily to kind of get that infection under control. And we were helping get to the pharmacy. Like, he couldn't get to his pharmacy. He had no transportation. He wasn't taking his medication. So we had, our medication is sent to the home every 2 weeks. He was starting his medication regularly. And I mean, just in like a couple weeks, I ran into him at the center, and he had this long beard hanging over. He had like holes in his clothes. I mean, it was like really sad to kind of see this man in his home. And within a month, I was just elated. He was shaven. He had like a polo shirt on with nice moccasins. Like, he just looked so wonderful. His foot was healing. Like, it's just amazing the difference it can make when there's somebody really kind of helping manage, helping you get to appointments, helping you get your medication, and just making sure that you're able to get to your appointments. It was a tremendous just a tremendous difference in the way that he felt it looked like, and the way that he was, taking care of himself. So I just think that that's like one of the most rewarding things for me to see, that we're able to do that for someone when they don't have the supports that they need. I feel like that's like the best part of being a part of the program. So, that being said, is there any other questions that I can answer? Before, I was just going to show a few minutes of a video, and then if there's anything I can talk to anybody offline about, I'd be willing to do that.
You'll have your contact information given shortly, I assume?
Yes. Mm-hmm. Yep, here it's even, there it is. My name's Regina Floria, and there's my email and my contact information. Now there's two cell phone numbers here. The one in bold that's larger, I would say that'd be the first contact number. And then you see there's a different one down here. There's two numbers to reach me. Excuse me. There you go. And then, like I said, I'll be giving that to you. And then, so I was just going to show, this is a video just to kind of give you an idea, like a day in the life of life. So if you, just like a few minutes, and then, yes, does anybody have anything else before I start? Okay. Let's see.
Is the video showing on your computer, Regina?
Yeah, hold on 1 second. I think it's wrong here. Okay. I'm trying to turn it off here.
You
I
might
was
need
at
to you might need to stop sharing your presentation and
Okay.
switch to, yeah.
Okay, thank you. And then I think I had to play in twice, so there was an echo there too. All right, let's see. So new share maybe? Let's see. Can you see it now, or is it still?
No, it's still your presentation.
No. Okay, okay. Let's see. Oh. Sorry about that. Let's figure this
Yeah,
out.
if you stop the shit, yeah, okay.
Okay. And then, okay. How about, what are you seeing now?
Just seeing you.
Just seeing me? Okay. Let's see. All right, let's try this again. Oh, sorry, I knew that you can't see this yet. Shoot. Turn this off. I don't know why it's not, I had no issue getting my video on here. Any suggestions as to what I'm doing wrong here?
But when you go to start sharing, can you see the video screen as one of the choices to share?
Let's see here. Let's see. Okay, so well, now can you see it now? No.
Yeah.
Yes.
Yes. There we go. Okay.
Oh, wonderful. Okay. All right. I'm sorry about that. Okay. Wonderful. Let me start it here.
Now we just see you again, though.
Okay. Oh, I'm so sorry. What the heck?
It had been up there, yeah.
It had been up. I just did whatever I did, just completely messed it up here. It's always the way with these things. I don't want anybody to like be hanging on too long. What I could do is, should we try another time, and then if not, maybe just can send the video out with the
I can send the link to the video along with your slides.
Beautiful. That's wonderful. I really think it's worth watching. So
yeah.
Does
anyone have any more questions for Regina right now? Either unmute yourself or put your question in the chat.
No questions, but thank you, Regina.
Oh, absolutely. Thank you for attending, and like I said, I'm more than happy to help in any way I can. If there's any questions, feel free to contact me. And no, just thanks again, and thank you so much, Mark, for all of your help too.
Sure thing.
I do have a question came up. For those of us who have more than 8,000 in assets, are there any, I mean, you might have a little, I know the little bit of like, oh, you could have a little bit more, but then we could look at what you could do. What if you have like, not a sizable more, but, it just seems like there's a heck of a lot of benefits for somebody who has less than those who might have saved some. So it's
Right.
kind of like, is there anything out there for those of us who have saved some, but really you can't really afford the services that you're providing because you don't have that much? So is there anything?
I know it's like I get exactly what you're saying. You're kind of like in the middle of the road there, and that's sometimes a tough place to kind of navigate to, like to figure out, is it worth, if there's a significant amount of, maybe that you can pay out to get down to where you need to be, or is there something, that you can kind of do with the funds that you have to, I mean, there's
Hi,
so.
Regina, this is Mary Beth. Everybody, I just jumped on. It's Mary Beth from the Mercy Life program. And Christine, you had a great question about the over asset, and I can help a little bit with that. So if you are over the $8,000 asset limit, it is not a barrier to joining the Life program, because there are legal spend downs that the county has and the state has in place. Such examples would be paying for home improvements. So say you needed a new roof on your house, paying for medical equipment in the home, repairs in the home, a ramp. And so you're spending down to get close to that $8,000 limit, and then Medicaid is initiated, the application for Medicaid is initiated. You can also private pay to the life program. We have people who are paying a monthly fee to get down to that legal $8,000 Medicaid limit. So over assets is not a barrier to life. Over income is a barrier to life. So, you know, again, every case is different, but there are legal asset spend downs in place.
It's very helpful. Thank you.
You're welcome.
Thank you very much. All right. So if there's nothing else, like I said, thank you very much, and take care and reach out with any questions.
All right. Thank you, Regina.
All right. Thank you. Take care.
You too now.
Bye-bye.